Hello. I hope this video finds you in good health. I just want to take a few minutes out to discuss our current situation with the COVID-19 pandemic. First, I want to thank Spirit for allowing me to wake up for another day. It's so beautiful outside. I know it's like probably only 60 something degrees, but there is not a cloud in the sky. The sun is out. I can see, I think the moon is at half full now. I can see the moon rising already, and it's only like 3 something in the afternoon here on the East Coast. But I live in North Carolina, and I've been watching the numbers for the COVID-19 cases rise and rise every day. Our state alone has over 5,000 deaths related to COVID-19. And I saw the governor speaking, giving an update with various health officials. And it doesn't sound like they're going to put everything on lockdown, but the way things are going, I won't be surprised if they do, because, and I'm guilty of this. I am definitely guilty of this. I still go to the store. There's still times where I have to go to the store in person to pick something up, but I wear a mask. I think I'm fairly good at keeping my hands washed, definitely social distancing, wiping everything down. But when it comes to spending time with family that do not live in my house, we have not been wearing our mask around them. And some of my family members work outside of the home. I still have my job. I'm still blessed to have my position, my full-time position. And I've been blessed to be given the opportunity to work remote. And I thank God for that. But there are family members that I still go around that do not have that opportunity, which means they have to work outside of the home. They have to work around other people. I'm not sure how close their quarters are to these other people, but from their job description, which I'm not going to reveal, their job description requires them to work kind of close with other people. So I'm sure they're wearing their mask and everything, but I don't know, and I'm not there. I'm not there to see what all has been wiped down, who all is wearing their mask, what they're touching, all this other type of thing, because COVID-19 can be spread by someone wiping their face or their nose area, their mouth area, and touching a surface, a hard surface. And then someone comes along and touches that same surface. And then they can pass it on to themselves, or they can take it home to their loved ones. So, and not only that, there's been like a couple of other family members that work in, another family member that works in the health field, 2 family members that work in the health field. So our family has had its brush with COVID-19, a light brush. And it did not hit me now until I started seeing those numbers go up and those deaths go up, that I started taking it more serious. And I should have done this long time ago, and I didn't, because it's like, okay, well, I know what I'm doing, so I'm not concerned. But I am concerned, because this virus is affecting people differently. Not everybody's feeling the same symptoms. Some people don't even have symptoms, but then others, they have all kinds of symptoms and they end up dying from it. So I just want you guys to think long and hard about having any kind of family dinners, family get-togethers, anything like that. Even if you call yourself playing it safe by social distancing when you get there and masking up and wearing gloves, how are you going to do all that when you're trying to eat? You're going to have to take the mask off to eat. So the best thing to do is just not go, not have a dinner, not have a family get together, because somebody is going to get it. And we don't know how it's going to affect that family member. Could not affect them, could fatally affect them to the point to where they die. So why take that chance? And as far as any vaccine, they keep talking about, oh, the vaccine may be released in December. Don't count on that. I wouldn't count on that, because the first ones that are going to get it are frontline workers, which they deserve some kind of protection, because the U.S. government, the Congress, they won't vote for another stimulus to help our frontline workers. They won't vote for another stimulus package to help people that really need it. So you can't count on the government to help you. Right now, while we're still in the era of Trump, we're still under a Trump administration. And the best thing for us to do is to just act like we're in it by ourselves. We have to fend for ourselves, especially minority communities, the black and brown community, because those are the ones that is hitting the hardest. I'm sorry, that was like 5 little birds just landed in this bush right in front of me. I wish I could turn it around so you could see them. I can't. Oh my gosh, you're so cute. While I was talking. Okay, I'm gonna keep talking. But anyway, so as far as us counting on the government to help us out of this, we're going to be waiting for quite some time. We're going to have to wait until there's like at least a couple of months into the Biden administration for any kind of help to come. We're going to have to hold on until then, because any kind of vaccination that's coming, it's not going to be ready until then, until months from now. So the first ones that are going to get it are frontline workers. That means people that work in the health industry, people that work in the hospitals and the medical centers and the nursing homes. And then after that, they're going to focus on the elderly and veterans, the sick, the ones that are at risk, the most risk. And it's the elderly and people that are diagnosed with certain conditions, pre-existing conditions that affect their autoimmune system. So they'll probably be like the third or fourth ones in line. So we're like, all of those that are healthy, we're going to have to wait. But don't, and also I want to point out, don't let that fool you. You think just because you've hardly ever been sick in your life, the last time you had the flu was like maybe a few years ago, you never broken a bone, you don't have high blood pressure, you don't have diabetes, you're healthy as a horse. You keep thinking that, and you keep thinking that this disease is not going to affect you. Think again, because there have been plenty, and it's documented. You can Google it. There's been plenty of people since this pandemic happened, since this disease got into the United States. There's been plenty of healthy people, perfectly healthy people, that it has killed. It's like it hit, to me, from the ones that I read, it hit them the hardest, because it's like they were fine one day, then they reported being sick and having a fever and not being able to breathe, went to the hospital and died within hours. So don't let being quote unquote healthy as a horse fool you into thinking that this disease is not going to get you, because it can. So I just want you guys to think twice about having these little get-togethers, even for Christmas. I know Christmas is a month away, but we're still knee deep in this shit. We're up to the neck in this shit. This pandemic looks like it's not going away anytime soon, because we've had a government, an administration that is not doing, they're out golfing while people are dying. They're sitting on their hands, not doing nothing. They're out trying to overturn a perfectly legal presidential election instead of passing legislation that will help people to survive this shit. They're not trying to do anything to help Americans. So we're in it. We're on our own. We're basically on our own. So, and the best thing to do then is for us to work together and to Listen to what the scientists have to say. If they're saying wear a mask, wear two masks, wear two pairs of gloves, then that's what you should do. Because this virus is nothing to play with. It's not. I've seen it. I've seen it at the point to where it's not affecting people at all. And this is from people that I know. I've seen people that had it and they had no symptoms. And I've seen it people that had it and they had a few symptoms. And I pray that I don't know, or that I am not one of the people that get this thing and suffer the extreme symptoms, because I've seen nurses talk about this shit. It ain't pretty. It is not pretty. It's not nothing that I would wish on my worst enemy. This is just awful. These people are, and another thing that should scare you is, I can't remember the nurse's name, but you should Google. She's a traveling nurse, and she did a video of when she was given an assignment down in Texas. I believe it was El Paso, one of the hardest hit hot spots in the nation. She was doing an assignment in Texas, in El Paso, Texas, I believe. And she got assigned to a hospital there. And she said she was assigned to what they call the pit. And she explained what the pit was. She said it's the part of the hospital, it's a section where they put COVID cases that they consider, that they deem that not helpable, that they can't help them, no matter what treatment they give them. But the thing is, she said there were hundreds of people that she had to deal with that were just dying. They were just there suffering, dying. They had to call in refrigeration trucks to hold the bodies because there were so many dead people. The morgue was full. They could not put them in the morgue. They ran out of space, so they had to call in refrigerated trucks. And also, she said, she saw this. She witnessed where they brought a lady in. They gave this woman the utmost, the ultimate treatment, the best treatment known to treat COVID, and that she got to go home. She was one of the very few people that got to leave the ICU that had COVID. And this person, this lady, was a doctor's wife. She said at that point she felt she had to leave. She had to quit. That was it. That's all she could take. Because they were giving people that had money, people that had status, the best treatment. Why, as everybody else, they were basically writing them off and letting them suffer and die in the pit. So I want y'all to think about that. And think about what I said earlier. Please, just play it safe. I mean, there's things you can do besides meeting in person and having dinners and whatnot. You can do FaceTime. You can go on Instagram. If everybody has an Instagram, you can have an Instagram chat room. You can have a hangout session on Google. That's not going to be for very much longer. I think December 31st is the last day to do that. But you can do a Google Hangout with your family. I saw someone did an article in reference to Zoom. Zoom is offering free Zoom meetings for everyone that has an account for the Thanksgiving holiday. And they'll probably do it again for Christmas, because this thing is getting nasty. So you may want to open up a Zoom account, have all your family members open up a Zoom so everybody can talk to each other, see what you're eating, talk, laugh, dance, whatever. Do it at home. You can do it at home. Do it safely so that we can have a nice Thanksgiving next year. Okay? Let me not answer that. Sick of people interrupting me. But so we can have a nice Thanksgiving, and we can be around for Thanksgiving and Christmas and that next birthday and all of that. Okay? So you guys, you be safe out there. And as far as like going to the grocery store and stuff like that, you don't have to go to the grocery store. You can order. Make an order. Get yourself a BJ's card so that you can order all kinds of paper products like tissue paper and paper towels. Get a Walmart account so that you can, because Walmart You can order that stuff and you can have it either delivered, they'll deliver it for free, or they have a pickup section where you can go and you can pull into the little section where they have the pickup orders, and then just on the Walmart app just type in what slot you're parked in, and they'll bring it out to you and put it in your trunk, and you don't have to talk to them or anything, you have to touch nothing. Okay, they don't have to get in your face or anything. You have to go in the store around all those people, because people, when they go in those stores, some of those people, when they go in those stores, they take those masks off. They don't think anybody's looking. They'll take their mask off and get all in your face and be all up on the back of you and stuff. So yeah. So restaurants are doing orders, pickup orders. Grocery stores are doing pickup orders. Just about everybody's doing a pickup order now. I mean, I know the small businesses are not really doing that as far as like online stuff, but if you call them and ask them, hey, there's a certain specific product that I want that I saw on your website, can I order it and come pick it up? They may be able to work something out with you. At least you're trying to avoid going out into the public around other people. Just order it and have them put it in your trunk when you go pick it up. So just try to play it safe. Act as if everybody that you know has it, everybody that you don't know has it. That way I think we'll be able to get through it, because it's just now hitting me that I still have not been doing the best that I can as far as like being safe. I was talking to my family today, and they agreed. No Thanksgiving dinner this year. Probably no Christmas dinner. Probably no birthdays, because I know my two nieces, their birthdays are coming up. So probably won't get to go. Have to do it FaceTime or from a distance or something like that. But I mean, it is what it is. I'd rather do that instead of go around them and make them sick. Me and my daughter, we're going to go get some COVID testing tomorrow. So, and actually, this is my first test since this started. I haven't felt the need to do it, but all this is going on and the numbers are rising and it's getting worse. I feel, yeah, I need to go get this done. But anyway, y'all play it safe, okay? All right, go get tested if you have a chance. Just contact your local health department. That's who I'm getting mine through. They did ask me for my health insurance, but I'm sure if you don't have health insurance, they're not going to charge you. They said something about it being free. So just go on their website. I'm sure they have like some kind of assessment tool. Fill out the assessment tool. Fill out any kind of form. Find out when they're doing them and go drive in your car, sit in line and wait for them to give you your test. It'll take a few days for it to get to you, but at least you'll know. But even with a test, if it says no, I don't know what it's going to say exactly, but if it indicates that there's been no COVID-19 found in your test or whatever, you should still give yourself enough time to make sure that you have no symptoms. You should still quarantine yourself for a few more days just to make sure. Okay? But anyway, I love you guys. Thank you for listening. And please, 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 please take every single precaution that you know about. If you don't know any, if you're not sure, look on the CDC website, look on the Johns Hopkins website. That's where I've been tracking all the numbers globally and nationally. Look on your county health department. Look on your county website. You can also find it on, I'm sure, your state government website as well. Okay, the information's out there. You just have to look for it. Don't ask your friends. Don't ask somebody you know across the street or whatever. Look for the professionals, okay? Ask the professionals. Because no telling what kind of answer you're going to get from Bobby Sue that lives across the street or whatever, okay? Just get your information from professionals. If you're not sure and you can't access the internet, call them, okay? Call them on the phone. Google them. Call the operator. Say, yeah, can you give me the number for what, the health department? And they give you the number. Call the health department and ask them, okay? So I love you guys. Play it safe, and I'll see you next time, okay? Peace, love, and light. Bye.